Hi, my name is Ramona Danielson, and I'm presenting on behalf of myself and my colleague, Grace Najau. And we are presenting an analysis of PRAMS data in North Dakota, in which we seek to understand unintended pregnancy among women in North Dakota. We have no disclosures. The North Dakota Pregnancy Risk Assessment Monitoring System, North Dakota PRAMS, began in 2017, and our analysis is using the combined data set of 2017 and 2018 with a total N of just under 20,000. Our survey methodology is to sample 1 of 6 women with live births each year, with an exception that I'll share in just a moment. In our analysis, we look for significant differences in substance use during pregnancy using chi-square by age, race, adverse childhood experiences score, which was a score that ranged from 0 to 10, created from CDC survey module questions that North Dakota elected to include in our survey. A variable that looks at any experiences with depression, if they had depression before, during, or after pregnancy, and substance use during pregnancy. And substance use can be legal, illegal, or prescription medications. This includes prescription painkillers, stimulants, marijuana, K2, methadone, heroin, amphetamines, cocaine, tranquilizers, LSD, huffing, cigarettes or e-cigarettes, and or prescription antidepressants. It excludes over-the-counter painkillers, and we did not have a variable asking about alcohol use during pregnancy to include in our analysis. We would like to thank the women of North Dakota who have responded and continue to share their experiences through PRAMS. We do have representative data for Native Americans in North Dakota PRAMS data set. The North Dakota Department of Health partnered with each of the 5 sovereign tribal nations that share geography, at least partially, with North Dakota. And the survey was sent to all women who identified as Native American on their infant's birth certificate. And we'd like to thank each of the tribal nations for their participation in North Dakota PRAMS. Each tribal nation receives the data of participants who indicate that they're an enrolled member of that tribe. And then North Dakota Department of Health looks only at the aggregate data. Well, data not broken down by tribe. So in our analysis, unintended pregnancy were respondents who indicated on a question about how they felt about being pregnant, that they wanted to be pregnant later, they did not want to be pregnant then or at any time in the future, or they were not sure if they wanted to be pregnant. And unintended pregnancy is a risk factor for poor maternal and birth outcomes because women may not have prioritized healthy behaviors before conception if they were not planning to be pregnant, and women may not get adequate prenatal care during pregnancy. And this can lead to undetected health risks for both the mother and the infant. 43% of North Dakota pregnancies were unintended. Again, the unintended wanted to be pregnant later, did not want to be pregnant then or at any time, or they weren't sure, and the intended pregnancies, including those who wanted to be pregnant then or those who wanted to be pregnant sooner. So 43% were unintended pregnancies. Unintended pregnancies were more common among certain women. 81% of the pregnancies to people under 20 were unintended. 63% of the pregnancies among Native Americans were 63% were unintended. 56% among women who used any kind of substances during pregnancy were unintended. Among women with depression before, during, or at time of survey, 54% were unintended. And among women with an ACE score of 4 or higher, 50% were unintended pregnancies. And this compares to no substance use in pregnancy, 38% compared to 56%. Here we have 39% who had no depression compared to 54%, and 36% among women with 0 ACEs compared to 50%. So 2/3 of women that had had a healthcare visit in the year before getting pregnant, that is 55% of women with unintended pregnancies that had a healthcare visit in the year before getting pregnant. 77% of women with an intended pregnancy had a healthcare visit in the year before. The majority of women who had a visit had not been asked about their desire to have children, 60%. Women who had an unintended pregnancy were more likely to not have been asked, 74% compared to 54% of those with intended pregnancies. And the vast majority of women under 20 who had an unintended pregnancy had not been asked about their desire to have children. So this is a missed opportunity that healthcare providers didn't ask about desire to have children. And women with unintended pregnancies were less likely to start prenatal care as early as they wanted. Among North Dakota women with intended pregnancies, 7% said they were not able to start prenatal care as early as they wanted. And this is compared to 18% of women with unintended pregnancies who said they did not get prenatal care as early as they wanted. There are several factors associated with unintended pregnancy among North Dakota women, according to our analysis. This includes young maternal age, race, particularly American Indian in North Dakota, a high ACE score of 4 or more, having experienced depression, and having substance use during pregnancy. Many women are not getting annual healthcare visits, and many healthcare providers are not bringing up the topic of planning for or preventing pregnancy. It is important to empower women to have conversations about their desire for children now or in the future and ways to prevent pregnancy. We can improve access to culturally competent quality healthcare, and we can encourage women to have an annual exam and to bring up these important topics. So implications of our study include understanding patterns of intended and unintended pregnancies, providing insights into women who may benefit from more support before, during, and after pregnancy. For example, women experiencing depression, women with a history of trauma, and women with substance use during pregnancy. And better understanding can lead to preventing birth complications, such as premature birth or neonatal abstinence syndrome. We are happy to answer any questions that you may have. This is our contact information. Thank you very much.